Your Personal Health Dossier is a digital application that allows you to manage your medical and healthcare information. It contains health-related information that healthcare professionals use to provide you with the best treatment. Since a Personal Health Dossier contains digital records, you can grant access to them to your care team, trusted associates, and family members. Anyone seeking access to your data will require your consent. You can designate someone to manage your Personal Health Dossier and also manage personal health dossiers belonging to those for whom you are authorized. A Personal Health Dossier uses a standardized way of storing and transferring records so that all of your health organizations can talk to it and understand the records. It has a special format for the records that ensures the integrity and security of your healthcare data. Your healthcare records are scattered over a variety of systems that you don't have access to. Healthcare practitioners in different hospitals, doctors' offices, and clinics all use different software systems, and those systems do not easily talk to each other. If one of your providers needs data from another, they have to request it, and it could take days or weeks for the information to arrive, and that is if the practitioner knows that the records exist and you're able to tell them who to contact. Basic information about your medical history is not available in an accurate format. Basic information is repetitively collected. Every time you have to see a new practitioner, they all ask the same basic questions. Do you have any allergies or intolerances? What medications are you on? What existing conditions do you have? You may not have this memorized, and if you do, you still may have the information wrong or the practitioner can record it improperly. Your healthcare records eventually go away. By law, healthcare practitioners only have to keep your records for a few years. If you're healthy for a long period of time, all your records could have been destroyed. Over the years, clinics come and go, practitioners move to new locations or retire, and the records of your diagnoses, treatments, and medications slowly disappear. Personal health dossiers are great at facilitating patient-provider interactions. They can manage all interactions you would have with your care team. A personal health dossier enables personal decision support. It can provide support on diagnosis education, lifestyle choices, medication adherence, provider selection, shared patient experiences, and treatment education. For instance, a personal health dossier can be used as a personal health journal to track diet, exercise, and symptoms, as well as having options for personal health monitoring and management, such as home monitoring device data collection, symptom diaries, self-assessment, and self and wellness management. The personal health dossier can provide a means to receive health-related reminders, such as appointments, visits, and consultation times, immunization and lab reminders, and following medication instructions. A personal health dossier supports personal health advocacy. It can communicate with patient advocates and navigate complex systems like healthcare expense billing and tracking and insurance coverage. Your personal health dossier has several layers of protection. To begin with, your personal health dossier resides on your mobile phone. You get to decide who has physical access to your phone, what network or Wi-Fi to connect to, and even when you want the phone on or off. Your application is protected by your PIN or biometrics on your phone, as well as having a password on the Personal Health Dossier application itself. Anytime you send or receive data with your Personal Health Dossier, the data is fully encrypted while in transit. On top of that, your data in your application is encrypted while stored on the phone. The integrity of records in your Personal Health Dossier is protected using cryptography. This ensures that the contents of your records are accurate and have not been tampered with. Your Personal Health Dossier goes wherever you go. You are the one common participant in all of your healthcare activities. You are there to receive all of the healthcare records that come out of your encounters with healthcare providers. You are also the best person to decide who is allowed to access your personal health information. Anytime you have an appointment with a healthcare provider, you will have all of the information from the other providers and your own observations to share with your provider. Your healthcare providers no longer have to repeatedly ask the same questions. They're able to access your comprehensive set of records, your Personal Health Dossier. They no longer need to request records from other sources that may create delays in your treatment. The records in your Personal Health Dossier are all in a common format, so that all of the systems you encounter can read your data and use it properly, as well as send you information in the same common format to save to your dossier. The technical capabilities of a personal health dossier provide a much more private, secure, and confidential environment for your personal health information. It significantly decreases the risks of data breaches, falsification, tampering, and corruption in traditional health records. With a personal health dossier, you have ownership of your medical records. You can grant access to your care team, making it easier for them to get timely access to your dossier. You decide what information to keep and for how long. To operate your personal health dossier, you will need to have a mobile device. Your personal health dossier requires software, communication, and storage. Without a device, you will not be able to use the system. You will also need internet connectivity. If you can't access the internet or Wi-Fi, your personal health dossier can't interact with other people and systems. Since your personal health dossier uses cryptography, the security and privacy of your health data is based on you keeping a secret cryptographic key. This digital value will be stored on your device. If your device is lost, stolen, or breaks, you will lose access to your personal health dossier. It is now your responsibility to make sure that you have made adequate backups of your data and cryptographic key. Now that you are the owner of your personal health dossier, you need to take responsibility for making sure that it's updated with each medical encounter and that you provide consent to the correct people and organizations. Your personal health dossier is only as complete as you make it.